Fabulous. Thanks very much, Sandra. And hi, everybody. Thanks for joining this Lunch and Learn. This is one of a series of events that anybody is welcome to join, introducing you to different components around improvement and helping you learn from some case studies and experience from across the country. We've got two fantastic stories today focused on the topic of leadership behaviours. When we think about improvement, what we mean by the word improvement is an applied approach to problem solving, bringing people together to think about what are the factors that contribute to a complex issue that we're trying to solve, and then what ideas might we have that would help us solve the issue, testing and learning as we go. And in that approach, what's really key is that we do that in an environment that enables us to be creative, to try things out, to learn when things don't work so well, and to know that we have support, because sometimes this is definitely going to involve changing the system, and we may well need support for that. And in creating that safe environment, that safe, psychologically safe space, leadership is absolutely key. And every example of organizations or health systems that have really embraced continuous improvement have at the heart of it a shift in leadership from being command and control, from feeling like they have to have the solutions to problems, to seeing their role as very much around problem framing, creating an environment in which others can solve problems, and really thinking about how they can learn from what's happening at the point of care and the ideas that are being tested. So I'm delighted that we are going to dive into this topic today, and that you've joined us to learn about how two organisations are thinking about leadership in the context of their commitment to adopt and embed improvement. So thank you, Elizabeth Hale and Peter Lowe, for joining us today and sharing your work. Two colleagues who are right at the forefront of this field, leading improvement in their organisations. And we're going to hear from both of them about their thoughts and ideas and work on the topic of leadership behaviours as part of their approach to really embedding an approach to continuous improvement across their big, complex organisations.
Good afternoon, everyone. Very excited to be here. I'm Peter, and thanks, Elizabeth. That was a fascinating story. Thank you very much. So just before we came on, we were just getting the tech ready, checking we could take control and everything. And Amar said, just to let you know, guys, there's the biggest number of people that have registered today on this Lunch and Learn, so no pressure. So I just wanted to say, I feel really humbled to speak to you all today. I know there are people on the call with far more experience than me. I haven't written a book, I haven't got a PhD, I haven't worked at Toyota. I only bring my own lived experience of improvement leadership from the last 6 years. So I offer my thoughts on improvement leadership, not as an expert, but as an improver myself. And I'd be very grateful of your reflections on how I can improve these messages in leadership development sessions that we run at my trust. So Dudley Group is a acute and community trust with about 6,000 staff. We're also part of a collaborative, the Black Country Provider Collaborative, with the trusts at the that you can see on the screen there. And we've been collaborating with our improvement teams and working together. And in recent months, we've been talking about how we specifically look at developing improvement leadership in a consistent way. Up until 2018, at Dudley Group, we didn't have an improvement system, and I was asked to set one up. We designed our approach and method together in collaboration with 6 other trusts as part of the Vital Signs programme, which was supported by NHS England, and each trust locally branded their method. We called ours the Dudley Improvement Practice, or DIP. And I was very keen that we have a person-centred approach to improvement. So although we do deliver a suite of accredited improvement training, we spend far more of our team's capacity on post-training support to really develop the capability using the DIP method throughout the trust. I think there's still a lot that none of us know about improvement in healthcare, and particularly about how to develop the most helpful leadership styles. And to me, that makes it a really exciting place to be, because there's so much opportunity to learn every day. So I wanted to say, If you disagree with any of my points today, then please put your alternative ideas in the chat, because I see creating a discussion of different views as being a success. So this one is what I call 20th century and 21st century continuous improvement. I know the iceberg must be the most cliched management graphic ever, but I'm using it anyway. It's fairly obvious that if you like something, you try to copy what you see in order to create the same results. And that's how Lean developed in the 1990s. And these visible tools that you see at the top of the screen there and practices are still very much the backbone of most improvement training, including our own. They're still very useful, and we train these tools today, but they're not the whole story. So in recent years, there's been a much greater focus on the unseen contributors to those successful outcomes. So here, my own definition, or my preferred definition of culture, is habitual ways of thinking and doing. You'll have your own favourites, but that's how I like to describe it. And in yellow, I think these are some of the most significant habitual ways of thinking and doing that help create a culture of continuous improvement. And then there are the well-known leadership behaviours that underpin it all. And I've added a few of them there, but that's just a few of a very long list. So the components under the water in the dark blue section are the unseen contributing factors. And that's what I think there's been much more focus on in recent years. And so sort of 21st century continuous improvement, but particularly relevant to improvement leadership. And it's these things that I think are more valuable to include in leadership training than the items above the water. So Elizabeth mentioned the importance of coaching, and I certainly agree. I think most people on the call would be able to explain why coaching is so important to create that culture of improvement. And I think it's probably the most commonly and sort of most understood leadership attribute that we want to try and develop, amongst others. The most common feedback that I hear from leaders is how difficult it is not to give someone the benefit of your experience by suggesting a course of action in any given challenge. And when you believe you know the answer, it's difficult not to share it, even with good intentions. But when you believe you know the answer, it's also very difficult to learn. Many managers are aware of the long-term benefits of coaching to develop problem-solving capability, but still find it very difficult to allow the ownership of the solution to stay with the person experiencing the problem, because the manager inadvertently takes ownership by fixing the issue themselves, even though, as I say, with good intentions. And then there's also the trap of knowing that you must ask a question rather than giving the answer, which then comes out as very clear advice, thinly disguised as a coaching question. But the thing is, when leaders make these observations about their own practice, they should be commended, because it's evidence that they are becoming aware of their own behaviour and starting to practice something different. A good coaching style takes practice because it requires you to let your own solution thoughts come and go in a kind of mindful-like way. And it's about genuinely being interested in learning about someone else's ideas and then being curious enough to help develop their thinking. The difficulty is that when it comes to improvement leadership, we do know the answers. And John Tisson and Kim Barnes, as just one example, have written a book here about some of those principles and behaviours. And it's full of really useful lists. There are loads and loads of them, just many more than just the couple that I put on the screen. But as the title suggests, there is more to it than just replicating lists of behaviours. And yet, a lot of improvement leadership training involves talking through these attributes and behaviours and then asking people to practice them. Now, in my view, we're not living our own values in that case. we're not practicing what we preach. We say you must coach, don't tell people the answers, but when it comes to leadership behaviours, here are all the answers. This is no more coaching than it is when we tell a lead nurse how to discharge patients earlier by implementing home for lunch schemes, or advise how to run a board round and so on. Some of you may well have genuinely coaching approaches to developing these behaviours, so please do let us know about those. I think the question for us is, how do we role model the approach that allows leaders to develop their own skills, capabilities and practices, rather than giving them our behaviour answers, such as some of those on the screen? When it comes to purposeful practice, we know that people only practice purposefully when they are intrinsically motivated. And being provided with the answer doesn't usually produce intrinsic motivation. We need to be involved in the why, which is why, we talk about and advocate co-design and co-production. It's all about being involved in the why and the purpose. Just like everyone else, board members and senior leaders need to feel valued and respected for their wealth of experience. So we need to genuinely believe that they will come up with behaviours to practice of their own that we might not have thought of. So I'm not professing to have cracked it, but here are some of the things that we're experimenting with. So in the sessions that we run, we have conversations, we facilitate conversations about topics such as those in the circles, and interesting to see a lot of similarity with some of the things that Elizabeth mentioned. These conversations generate really constructive thinking amongst senior leadership teams, and they create their own leadership behaviours to practice, having had those conversations and being part of those conversations. So far, all the groups that we've run this with have said, do we have to stop at 3 sessions? Can we keep going with these sessions? And that's great, that's a bit of a success metric. But the part that we need to improve on is that so far, only 43% of delegates on this Improvement Leadership Conversations course are maintaining the practice in coaching pairs after the sessions. So we need more of your success stories to help us with that part. It's the purposeful practice that I think is really important to developing leadership. Just to give you a little bit of a taster on some of these sessions. So for example, we run a session to see what we can learn from each other about how to create more psychological safety. So we get into, what it is and what it isn't. It's not about avoiding difficult conversations or about accepting lower standards. In fact, it can create a space where people voluntarily take more accountability for higher standards of care. So there's often some really good conversations that come out just talking about psychological safety and some of the misunderstandings. We also have discussions, and we practice questions to ask on go and see visits. So we learned the other day that some questions asked with a coaching intent, really positive intent, actually can create unintended emotional reactions. For example, let's try it and see if it works. Said in a really encouraging way, you think you're saying the right thing, but some people can hear that as, well, what if it doesn't? So the group came up with an alternative, which was let's try it and see what we learn, and I think, you can keep on evolving these questions through conversation. In summary then, I believe developing improvement leadership can happen from applying our principles of improvement practice, genuinely believing we don't know all the answers, and creating the right space for quality thinking to take place, which then leads to intrinsic motivation, purposeful practice, and learning. Thank you very much for listening.
Super. Thank you so much, Peter. Thanks, Elizabeth. Really great to hear your reflections, your experience, your work so far in this area. Plenty for us to take away. I'd invite people who are on the session now just to have a think if there might be any questions you want to put to Elizabeth or Peter or both.